Martin's just asked me some questions about the surviving hormone therapy course that I do. And actually, it might be useful to sort of go back and think, how did that come about? Because I never set out initially with the intention of doing that. When I was diagnosed, and over actually what turned out to be quite a long protracted period, because various of the tests that I had didn't tie together. But this gave me plenty of time between consultations to kind of go away and read up on what was likely to happen to me next, what my next options were. And, you know, that's my style. When I was then in a consultation, I pretty much knew, well, I'm going to get told this or this. So either this is going to happen or this is going to happen. So I went off and kind of prepared for those things. And I was pretty sure I was going to be offered hormone therapy. So one of the things I'd gone off about was to read about it, so that I knew if I wanted to have it or not. Well, I guess nobody wants to have it, but, you know, was it a sufficiently bad thing that I might steer well clear of it? But actually, I in my reading around, I discovered that those got a lot of things, issues that men, you know, bring up as bad factors about it. A lot of them were avoidable or were temporary. And I decided I could deal with a temporary, you know, bad factor for you know, up to 3 years for the sake of being cured of prostate cancer, if that was an option. And I could possibly work my way around some of the other side effects of the hormone therapy. So that, you know, ultimately I decided that I would go down that route. It seemed like the best treatment option for me, given my diagnosis. I'd actually got very little out of the clinicians about what would happen when I went into hormone therapy. You know, I have mentioned before that patients don't get any kind of counseling as they enter into it. They might get given a booklet that describes hormone therapy. You don't go home the day you've just been told you've got cancer and start reading a booklet on hormone therapy. You've got other things on your mind at that point. But I'd already done some sort of pretty good research on it, so I went away, and I was actually sort of reasonably satisfied that I knew what I needed to do, and I knew what I could put up with for, you know, up to 3 years if I was on it for 3 years. So that was really quite useful for me. I never thought of it any wider than that. But I started going along to support group meeting and actually discovered, when people talk about hormone therapy, that most people didn't know much about it. So that was quite a useful opportunity for me to talk about, you know, what I'd learned. So a couple of consultants on the way kind of said, you really ought to be talking to support group, Andrew. You've got some interesting knowledge and you can help people out. And that got me into thinking, well, what could I put together? Actually, the first thought was I keep loads and loads of records about me. That stems back to the work that I did before, where I guess, a bit of a data scientist analyzing data. So I'd pointed that at me. But actually, I thought that's probably rather boring for most people. So I then thought, well, actually, the hormone therapy would be much more interesting thing to talk to people about. So I started to put together a talk on hormone therapy. And one of the consultants actually spent an hour with me going through this talk, the very first sort of form of this talk, when I gave it. So that was the guinea pigs for that were the Mount Vernon Prostate Cancer Support Group. And that session just went way over time. I think, you know, it's normally an hour, and after a couple of hours, I had to stop because I had to go off to have a radiotherapy session myself. But it was great success. And from that, I then started to do a bit more work to fill in more of the holes, because some of the things that weren't of particular interest or concern to me were to other people. So if I'm going to give a talk, it needs to be a more complete talk. And I actually went and spent quite a lot of time going through research papers to fill in the holes and make the talk more and more complete. And that's never stopped. So although I started giving that talk at Mount Vernon, it was a half-day workshop. I carried on learning about it, and I've carried on doing that today, up to today. And, you know, I have learned more and more as I've gone. And actually, I have to say, various clinicians have been really helpful in providing me with information and discussing issues with me. and some of which have gone into the talk. So that's how the talk came about. It continually changes. I'll say before COVID, it was a half-day workshop at Mount Vernon, which I ran about every 2 months. COVID stopped that, and I thought, well, how can I carry on doing this? And actually, because the support groups all switched to Zoom, that was a splendid opportunity to be able to connect with the support groups around the country. And I guess I probably presented it to most of the support groups which are running now. Indeed, in one case, I was asked back to do it a second time. So a lot of patients and partners have seen that session now, and I've got a lot of really good feedback, and I use some of the feedback to add other things. When I get asked lots of questions in a particular area, that area grows. I'm kind of used to the things that people are going to ask now. So at the beginning of the session, to try and get the audience talking, because I like it to be interactive, not just me preaching, I'll start off by saying, right, fire me some side effects of hormone therapy. I always get the first one. It's pretty well always hot flushes. Then the various others start coming in different order. Sexual function seems to be a really big topic. It's interesting to see if anyone's got the courage to bring that up. If they haven't, I'll bring it up to make sure that it's on the table and we cover it. And then it's a question of what can I fit in the time? Because most of these, I don't have half a day. The half-day workshops were great. We could take our time and go through everything. So I have to adjust the content of the talk when I'm delivering over Zoom, where no one's going to sit for half a day, to the issues that people actually bring up, and I'll try and make sure I cover those particular issues. I have tried cramming it into quite short lengths of time, and that was a mistake. So I'm quite insistent now that when somebody wants me to do the talk and they say, can you do it in 40 minutes? The answer is no, I can't do it in 40 minutes. Can't cover enough to make it useful. But anyway, that's kind of how the talk has grown to what's in it today. And I do get quite a lot of follow-up from it as well. Which areas? So I get quite a lot of questions actually asked about the things relating to sexual function. Will come up afterwards, things like PD5 inhibitors. So some cases I dive down quite deeply into the differences between different PD5 inhibitors, which is something that's not terribly easy to find out. Just recently, particularly over COVID, there's been an awful lot of more detailed questions about how to use a pump, because none of the pump clinics are happening. So whilst it's great if you can get to a pump clinic and have a pump demonstrated on you, most people have not had that over the last 18 months, and just get given the thing without being taught how to use it. So that's something that's come up quite a lot, and I've been asked about afterwards. And I do get some feedback that says that some of the things I talk about at least do work for people who've gone off and tried them. Some of the feedback that I've got, particularly from the support group leaders, has been really very interesting. It's along the lines of their members felt really comfortable asking a fellow patient questions that they would not have been comfortable asking their clinician. And I guess that's because I've been there and I've experienced some of it. And some questions, you know, when you've got a clinician sitting in front of you who's concentrating on saving your life from cancer, asking some questions just seem bizarre. Now, okay, I'll pick an example of a question that comes up perhaps one every 4 or 5 times. It's, when am I going to lose my body hair? And, you know, that's kind of really important to some guys who are on hormone therapy, but it's not the sort of thing that you feel comfortable asking your clinician about. And your clinician probably doesn't actually know because he's never been on hormone therapy. So, you know, I can relate some of those stories from my own experience, but obviously I need to qualify that with, you know, it varies from one person to another. But nevertheless, you know, if I'm there as a patient answering questions which I've either got the answer to based on my own reading of research papers or from my own experience of being on the treatment, then I think that's really valuable for patients. And that's something that actually they would struggle to get an answer from a clinician, and even, you know, clearly struggle to even ask a clinician in the first place.